how common is back pain in terms of just the general population?
So this is one of the questions that we get all the time in terms of numbers. And I can tell you that every time I see a talk on back pain, the number's different. And it's 200 million people will experience it in their year in the US or in their lifetime, or 150, and I'm not sure what the exact number is, but almost everyone at some point in their life will get some kind of back pain. Now there's really varying types of that. There's the back pain because you decided that all of a sudden you were gonna, shovel and rake a bunch of snow for 3 hours or something, or rake a bunch of leaves, and you don't normally do that. You're sore for a day and it gets better. And then there's the more every day I have chronic back pain type problems. So there's a wide spectrum of that, but I would say anyone who's made it to adulthood has probably experienced at least some stint of some discomfort with their back.
So incredibly common.
Very common. Probably, I'm biased as a spine surgeon,
right.
But probably one of the most common health issues in the country.
And one of the largest forms of disability in the United States of America.
Well, the biggest problem with your back is that, as I tell people all the time, if you sprain a muscle in your arm, not to get into the minutia, but we could always just put you in a sling for a couple days. I'm not recommending that, but you could do that. You can't put your back in a sling. You can't not use your back muscles. And as we figured out over the last 50, 60 years of medical education is that resting your back too much is normally counterproductive. So just going to lay in the bed for 5 days because your back hurts normally doesn't make you feel better.
Right.
So it is a bit of a conundrum because there's lost hours at work, there's lack of productivity with your family and your friends, and then just the mental stress and duress that it can cause from having a chronic issue if it becomes a long-term problem.
Which I do want to touch base on with you a little bit later about the thought processes and belief systems behind back pain.
Absolutely.
And how that plays into disability. We'll get to that. I wanted to go more down the road of the most common low back diagnoses that you see.
Yeah, so I think when someone comes in and sees me and they have low back pain that is, let's say it's been going on for 2 months, but it's a new thing for them in general. They normally function without back pain. In my head, I'm already thinking about what things these could be. And I'm thinking about what tests can we order that might help us figure that out? What treatments can we order that are not going to cause us harm if it's for the wrong thing, for instance? And in that regard, most people that come in with a back problem that are able to walk, so they weren't in a car accident basically. Those people, I'm sending them to physical therapy because the most common problem is a lumbar strain, is a tear of a muscle in your back that's not a complete tear. It didn't completely come off, but it's torn enough that it irritates them every time they stand up straight, sit up straight, use their back. The other, probably the second most common, or at least the second most common diagnosis that I see, is that some type of disc herniation in their back. And so those patients also tend to get better with therapy. So for the same reason, I would send them to therapy to start, but that would be something that down the road an MRI might help us see a little bit more of. So in my mind, I have the muscular problems or musculoskeletal problems, and that includes everything from arthritis to the muscle strains. And then we have the neurologic problems, and that's a bulging disc pressing on a nerve root, things like that. And a good physical exam can help narrow that down. But fortunately, we get to cheat a little bit, and by utilizing time and therapists, we're typically able to get them active and mobile and feeling better without having to intervene, and then we look really smart without taking on any risk. So.
Right. And just because, for whatever reason, our human condition goes to worst case scenario,
right?
How frequently do you see tumors and cancer, and how frequent is that?
So great question. I get asked that all the time when I pull up an MRI and I'm telling them how they have this disc herniation, and I can see them kind of looking through me sometimes, and then I'll say, do you have a question? They're like, but you don't see cancer.
Right.
Everyone's always worried about that, and which is fine because we all know someone. It's exceedingly rare. I can tell you I've had one patient that came to see me from a cancer hospital. They knew they had cancer and it was causing some issues with their back. And we had one patient, I've had one, that I got an MRI on that we were not expecting to see masses, and we saw some masses. And that was, obviously, it's an unfortunate conversation, but we're able to immediately get them to where they need to go to get some care and figure out what's going on. And that's no more fun for me than for the patient, obviously. We're wanting to get people back to life, and you see that, and it's not fun. But the vast majority of the time, we're getting an MRI that looks what I would call normal or age appropriate, and nothing that accounts for their pain, which typically means it's the musculoskeletal stuff. It's an alignment issue, it's an activity issue. And then occasionally we're seeing a small disc herniation or arthritis, and we obviously tailor the conversation for that.
And back to the fear of pain, even with a disc herniation, that doesn't mean that they're going to be disabled
Oh,
or
absolutely
have
not.
pain for the rest of their life.
Absolutely not. I mean, I've had, single digit patients that come in where I'm even thinking in my own head, oh man, this is not really a fixable problem. You know, these are people that are admittedly in their 90s and have had 8 surgeries, and that's a tough problem. And they know they have a tough problem. People that come in, they frequently don't see the light at the end of the tunnel, and they get into this circle of negative thoughts and almost kind of depression about pain or disability. Almost all of them, probably 15 and 20% here need spine surgery. Almost all of them are able to get better without surgery, and that's what we're going for.
Right.
But as I remind them, and of course I'm biased because I'm a surgeon, if we have to operate, it's not like we're operating and now you're going to be in a wheelchair the rest of your life. I mean, when we do procedures here, when I do disc replacements where I'm trying to keep motion moving and get pressure off the nerves, or even a decompression where I take out that disc herniation, those are things I'm doing to get people back to life. And the most common question when I indicate someone for surgery is, well, what am I going to be able to do and not be able to do? And I tell them that your mind frame is off. It's not about limitations, it's about time. There's a time where I'm going to hold you back. But at 3 months, if you want to jump out of a perfectly good airplane, that's on you. But I'm going to let you do it, right? And that's whether they have a big fusion or a disc replacement or a discectomy. Is that the goal of any modern spine treatment, whether it's physical therapy or a 3-level fusion, is to get them back to life, not to take them out of it. If they want to be disabled, don't go seek care anywhere. Just hide in a corner, right? That's why we try and get people to come in when I tell them what therapy can do for you, just being active and learning the right exercises, what some anti-inflammatories can do sometimes, what a steroid pack can do. I mean, that stuff can really be surprising sometimes, where I see people hobble in and on their next visit, they're skipping in and they're like, do I need to come back? It's like, this is great, know? So there's a lot of options. The important thing to remember is there's a light at the end of the tunnel. It's not a train. There are good
I like
things.
that.
Yeah.
I'm going to use that. I'm going to steal that. So